Hello everyone, I am Dr. Basil Mathew, Assistant Professor in the Department of Pediatric and Preventive Dentistry, Vinayaka Mission Shankaracharya Dental College. Today I will be dealing with a small topic called Operative Dentistry Modifications in Pediatric Dentistry or Restorative Dentistry Modifications in Pediatric Dentistry. Coming to the contents of today's lecture, according to AAPD, American Academy of Pediatric Dentistry, the objectives for restoring a primary tooth, the first is repair and limit the damage of whatever caries that has happened and protect and preserve whatever natural tooth structure is left and to re-establish the function. The function is mastication and aesthetics. Restore, as I have already told, restore the aesthetics, then to maintain the oral hygiene. Preservation of the primary tooth is important because should be preserved till the succedaneous tooth erupt, or to preserve the arch length or arch integrity, maxillary or mandibular arch integrity. It is important in the case of speech and phonetics. Then it is important to prevent infection or caries of the permanent dentition or upcoming dentition. Now, preserving the tooth is very important to prevent the malocclusion in the upcoming or the permanent dentition. And aesthetics. Now in detail I will deal with the basic cavity preparation or classification of cavity preparation in the case of permanent tooth, and then I will go to the detailed modifications that is needed in the case of a primary dentition especially. First, Black's classification, that is class 1 cavity preparation. It includes all pits and fissures of all teeth, including the anteriors as well as posteriors. That includes occlusal surfaces of the posteriors and lingual surfaces of the anterior teeth. Now occlusal 2/3 of the buccal and lingual surfaces of the premolar and the molars, because the gingival 2/3 or gingival 1/3 would be a different classification under the Black's classification of cavity preparation. Now class 2 cavity includes all proximal cavities on the premolars and molars. It includes all the proximal cavities or smooth surface caries of the all premolars and molars. Class 3 cavities, it includes the proximal again of anteriors only, but which doesn't involve the incisal edges or incisal angle. Whereas class 4 is a proximal surface of anteriors involving the incisal edges. Now class 5, it is considered as the gingival 1/3 of all teeth, including the anterior and posterior, either on the facial or lingual, whereas gingival 1/3. Now class 6 cavities, it includes the incisal edges or cusp tip of all teeth, that is incisal edges of the anteriors and the cusp tip of the molars and premolars. Now principles of cavity preparation, again this is the basic cavity preparation that we will follow for a permanent tooth, and later we will decide with the cavity preparation in the difference in the primary compared to the permanent. So the basic principles of cavity preparation, it includes an outline form, resistant form, retention form and convenience form. After that it will be removal of infected dentin, pulp protection, finishing enamel walls and debridement of the oral cavity of the cavity that is prepared. Now first, that is initial tooth preparation or primary outline form or initial depth. It is that form that will achieve the outline of a completed cavity, or it achieves the outline form of the final cavity it is supposed to be. And there is a primary resistance form. It helps the tooth and the restoration to withstand the masticatory force along the long axis of the tooth. The resistant form will help the tooth and the restoration to withstand the force that is along the long axis of the tooth, whereas primary retention form, that resists the displacement of or the removal of the restoration from the tipping forces or lifting forces, that is away from the long axis of the tooth. Now convenience form, whatever cavity that we prepare, if you are not able to restore a cavity adequately, then it is not a convenience form. So convenience form is a adequate observation and accessibility, ease of preparation and restoration of the tooth. For example, a cavity that will allow the insertion of a plastic condenser, plastic instrument or a parallelogram condenser have an adequate convenience form. Now coming in detail to the discrete modifications compared to the permanent cavity preparations or principles of cavity preparation, we will deal with each starting from the primary first molar, second molar, maxillary and mandibular. Now that is class 1 cavity preparation. We will see what are the modifications that is needed. First is a narrow occlusal table. The morphological differences of the primary and permanent will result in a reduced or narrow occlusal table, which will result in the reduced buccolingual dimension of the occlusal part of the cavity preparation. Second is the cavity depth. The cavity depth in a primary tooth is supposed to be 0.5 mm pulpal to the DEJ. That means the total depth of the cavity should be 1.5 to 2 mm from the KO surface angle at the deepest part of the occlusal surface, that is the deepest pit or deepest groove. That will be around the half or 3/4 of the straight burr that we are using. Now the cavity preparation in the class 1, again, in the case of first primary molar especially, the caries, if a central pit is used, if central pit or the mesial pit is involved, the outline form should be limited only to the central pit, avoiding joining the mesio-buccal and mesiolingual cusps. This is to avoid the exposure of the pulp horn that is present in the first primary molar, that is the mesiolingual or mesial pulp horns. Now the walls of preparation, it is always kept as parallel or slightly convergent occlusally. This is to prevent the dislodgement of the restoration, that is the primary resistance form which is in the primary tooth. Now, the pulpal roof of the primary tooth is slightly concave, so the cavity floor can be kept as a concave in nature in the case of primary tooth. Now, class 2 cavity preparation, the modification first is the extension of outline. In a class 2 cavity preparation, the occlusal box of the all first primary molars, it should be only extended to the halfway mesiodistally in the dovetail fashion in the case of a first primary molar. Whereas in the case of mandibular second primary molar, all pits and fissures, as it's shown in the picture, all the pits and fissures should be involved in the preparation of an occlusal box of a class 2 cavity. Now maxillary, only with the maxillary second primary molar, what you need to do is only involve the nearest pits that which is carious. The oblique ridge should not be crossed if it is not carious, so try to avoid the oblique ridge if it is not involved or undermined by dental caries. You have to prepare only the groove which is involved. Now the cavity preparation, especially for the proximal box, when you see the case of a class 2, the isthmus width, that is the width of the cavity preparation, should be half the intercuspal width or less than that to avoid the fracture of the restoration, because we have a lesser occlusal table. Now width of the proximal box, it should be greater to keep the margins in the self-cleansing areas. When you prepare a cavity, the principle says that the margins of the restoration and the tooth, that should rest in a place where it is self-cleansing area to avoid marginal leakage or secondary caries to happen. And then the axial wall, it should always follow the external contour, that is in a convex manner. The axial wall should follow the external contour of the tooth surface. Now the next principle, that in the cavity preparation of the proximal box in class 2, the axiopulpal line angle, it should be always beveled. The axiopulpal line angle of the class 2 proximal box should be always beveled. This is to avoid the stress that is concentrating at that line angle and to have a adequate bulk for the restorative material to avoid fractures. Next, the important thing is that enamel rods at the cervical area. The enamel at the cervical area, in the case of primary, it is directed occlusally, whereas in the case of permanent, it is directed gingivally. These are the differences in the anatomic differences in the crown or the enamel rod alignment compared to permanent. So based on that, when you have a cavity preparation, as the diagram shows, when you have a occlusally directed enamel rods, after the cavity preparation, all enamel rods that have been cut by cavity preparation will have a support from the underlying dentin, whereas in the case of permanent, as it is gingivally directed, the enamel rods which are cut would not have a support from the dentin. So in the case of permanent, we need to prepare a bevel, whereas in the case of primary, we don't need to prepare a bevel. So these are the major differences that you should be careful in the case of preparing a cavity in the case of primary, and should be followed so as to have a good restoration without a marginal breakdown in the case of a primary tooth. Now I'll just recapitulate on the modification that I've already told. First is the occlusal cavity preparation that you have to be careful, that is narrow occlusal table where there is a reduced buccolingual dimension. According to the dimension of the tooth, we should be careful when you prepare an occlusal table. And the cavity depth that you should be very careful about, as I told, the depth of the cavity should be at least half to 3/4 of the straight burr. It should not be more than that. This is a basic way to measure the cavity preparation. Now in the case of primary tooth, as I told, the caries, if its central pit is involved or the mesial pit is involved, it is limited to the central pit or the mesial pit, and it's avoided to connect the mesiobuccal and the mesiolingual cusp to avoid the exposure of the pulp horns. Also preparation, as in the case of a primary cavity preparation, it is parallel or slightly convergent, which is occlusally. This will prevent the dislodgement of the restoration, and the pulp roof or the pulp chamber of the primary tooth is slightly concave. You are allowed to keep the floor of the cavity preparation slightly concave. In the case of extension of cavity preparation, first molar we have to be careful that the half of the mesiodistal width will only be involved in the case of cavity preparation, whereas in the case of mandibular second molar you can involve every grooves and pits and fissures of the occlusal surface. Coming to the second molar, maxillary second molar, you are supposed to involve only the mesial groove or the distal groove, including only the pits and fissures in both sides, and oblique ridge is better not to be involved unless and until it is undermined by caries. Isthmus, what we know, that is the buccolingual width of the cavity preparation, it should always be less than or equal to the half of the intercuspal distance, intercuspal width. Width of the proximal box should always be kept and the margins at the self-cleansing area to avoid the secondary caries, and the axial wall should always follow the contour of the external wall, that is convex in nature. Axiopulpal line angle, it should be beveled to have the maximum bulk of the restorative material, whereas the enamel rods at the cervical area is always directed occlusally, and the gingival bevel is not needed in the case of primary compared to the permanent. So that would be enough for the cavity preparation in the case of primary, just the modifications as we follow it. Thank you.